If we observe closely, the patient's body is like an absolute machine. It responds to the IV fluids, it responds to the antibiotics. Sometimes patients develop fever due to severe infection. If we are giving antibiotics for 3 times, those 3 times just closer to the antibiotics, maybe for 3 to 4 hours, there is a good normal temperature and then they start spiking. That clearly shows that the infection in the body and their own body are fighting against each other. The antibiotic just helps them to get an upper edge over the infection present in the body. When the antibiotics concentration in the blood goes down, their body tries to increase the defense by producing the pyretic fever episodes. Similarly, for IV fluids, if you just prescribe a touch high flow of IV fluid, the heart rate will increase due to overloading, and vice versa happens if we decrease the IV fluids. This has given me a lasting impression. Once the patient recovers, he will say for the past 3 weeks, he don't know what happened. So our body is absolutely like a machine or vehicle given to us to lead the life in this world. While we need to think that we are that pure consciousness using the mind and body like tools for day-to-day life. This created a lasting impression and also impacted a lot in my spiritual passage. வாழ்க வளமுடன்.
Doctors have historically faced unique challenges. Could you discuss any specific obstacles you have encountered in your career and how did you navigate them, Doctor?
I am sure the answer for this question will really surprise everyone. The specific or the biggest obstacle which I encountered in my career is availability of job opportunities and money. Being a doctor, I can vouch and say 80 to 90% of the doctors will be more than enough with the job opportunities available to them and money what they are earning. Being a well-settled consultant in England, I have no limitation in patients to see, number of clinics to attend, teaching in a couple of universities, private practice, or doing some lectures for quite high-flung colleges. The problem is too much of opportunities will make us to run around too extensively, and at one point we can easily miss the tab. Too much of money will give us headache on how to channel them correctly. Say for example, if you want to channel them into appropriate stocks and shares investment, that will really pull out hours and hours of your life, making life very monotonous and very much materialistic. Fortunately, I had two principles which helped me to overcome or navigate these obstacles. The first one is I concentrated a lot in quality of patient care than the quantity. I will make sure the patients seen by me are getting appropriate follow-up and completeness of treatment. Only if I am doing absolutely good in my time frame, I will slowly expand my clinic capacity or number of days working, etc. Similarly, the money. Fortunately, I am quite self-satisfied with the money I have, and my plan is to make how this money can be stabilized to give a good support to me throughout the life, including my family. No aim in keeping millions and millions of pounds for the next generation and striving and compromising the health and the calmness in the life. Once we are very clear in these professional aspects, then we will have a good amount of time to focus on our body and mind management that will further give a lot of peace in life. வாழ்க வளமுடன்.